Tourniquet is a compressive device that occludes blood flow to the limbs to prevent severe blood loss from limb trauma during emergency, create bloodless surgical field, and decrease the perioperative blood loss, and for intravenous regional anesthesia to prevent the central spread of local anesthetics. Surgical tourniquets enable the surgeons to work in a bloodless operative field by preventing blood flow to a limb and allow surgical procedures to be performed with improved accuracy, safety, and speed. They have two basic designs: non-inflatable made of rubber or elastic, and inflatable. Pneumatic tourniquets use compressed gas to inflate a bladder or cuff to occlude or restrict blood flow. Limb occlusion pressure can be defined as the minimum pressure required to stop the flow of arterial blood into the limb distal to the cuff, determined by gradually increasing tourniquet pressure until distal blood flow is interrupted. Guidelines suggest adjusting cuff inflation pressure by adding a safety margin based on the patient's systolic blood pressure. Add 40 mm Hg for less than 130 mm Hg, 60 mm Hg for 131 to 190 mm Hg, and 80 mm Hg for over 190 mm Hg for pediatric patients. Adding 50 mm Hg is recommended. Methods to lower effective cuff pressure include double tourniquet technique to change the point of compression, controlled hypotension to bring down systolic blood pressure to decrease direct cuff pressure against the tissue, and Doppler technique and pulse oximetry to confirm absence of the arterial pulse to determine minimum inflation pressure. Safe tourniquet inflation time varies with the patient's age, physical status, and vascular supply to the extremity. A time limit of 1 to 3 hours is described. It is recommended to assess the operative situation at 2 hours, and if anticipated duration is more than 2.5 hours, then use a 10-minute deflation interval at that point and at subsequent 1-hour intervals. Complications of tourniquet include nerve injury such as paresthesia and paralysis, muscle injury such as ischemia, compartment syndrome, vascular injury, skin injury, and hematoma formation. Traction is a mechanism for straightening fractured bone or relieving pressure on a site, with types including skin traction and skeletal traction. Indications for traction are regaining normal length of the bone, reducing muscle spasm, reducing pressure on nerves, and preventing skeletal deformity. Skin traction indications include temporary measures for paratraumatic and femoral neck fractures, femoral shaft fracture in children, undisplaced acetabular fracture, after reduction of dislocated hip, treatment of minor flexion deformity of hip and knee, and management of lower back aches. Contraindications include ulceration at the site of traction, disturbance in local circulation, varicose veins, and dermatitis. Skeletal traction indications include cases of contraindication of skin traction, presence of external fixation, and traction weights greater than 6.5 kilograms. Plaster of Paris casts are the most commonly used material for immobilizing injured limbs. Indications include temporary immobilization of joints and ligaments to reduce pain and inflammation, splint of undisplaced fractures, augmentation for internal fixations of some fractures, and splint for tendon and ligament repair. Fiberglass casts have several advantages compared to plaster. They weigh less, are more durable and porous, allowing airflow, more water resistant, better for x-rays during healing, and available in a variety of colors.